So let's start. So hello everyone, welcome back to my channel Healing with Hina. This is Dr. Hina, PG scholar in NIH Kolkata. So after I joined National Institute of Homeopathy, I was getting so many messages and mail from students where they were asking questions like how is homeopathy in Kolkata, how they practice here, what is exactly is Kolkata method of prescribing, Kolkata School of Homeopathy, and they requested me to make a video on this topic. But I have just joined, like it's been only 9 months. I have joined a National Institute of Homeopathy. So I thought the answer to this question can be given by someone who is, deep rooted here in Kolkata and who have, a, homeopathic background. So the name which came into my mind was who better than son of a legendary homeopath and legend now himself, Dr. Subhas Singh, director of National Institute of Homeopathy. So I reached out to him and asked him if he can help me with this. And he being so kind and ever ready to help students in learning, he agreed to do this session with me, and for which I'm really grateful to him. So today we are here doing this session, and in this session we have divided it into two parts. So first there will be a presentation or a lecture by sir, and in the second half we will be having question answer session where you all can ask questions in your mind. The question has to be typed into the comment, and then you can leave that comment, and we will try to address all of your questions, but please make sure that no personal, political, or controversial question will be entertained. Only questions related to homeopathy and this method of Kolkata prescribing you can ask. So it's 3:05. I think we can start. So fasten your seatbelt and let's get started into this journey of homeopathic prescribing, which will be led by none other than Dr. Subhas Singh sir. So I request sir to please proceed with his presentation, and let's get started. Thank you.
I can sit here.
The camera is there. इसमें लिखिएगा सर. मैं इसको turn कर देती हूँ.
ठीक है. अच्छा, okay.
It's fine if I sit here.
Thank you very much, Dr. Hina, and thank you all who are attending here, or as well as those who are attending online. And also, today being a very auspicious day for Indians. Happy Makar Sankranti. Wish you all the best. Wish that the new year that commences from today will be a great one. And let us start with what commonly is known as Calcutta method of prescription. Truly speaking, there is nothing called Calcutta method of prescription. There cannot be anything called Calcutta method of prescription. Because if we divide this method of prescription according to areas, then you can understand that homeopathy is practiced all around the globe, with different countries, different areas, different districts, different cities. So it will be an endless thing. Calcutta method somehow has become popular because of many reasons. One is that in India, the homeopathy journey started from Calcutta. Though Honigberger, who is credited with starting homeopathy and bringing homeopathy to India, he first came to Lahore, which at that time was the part of Greater India, to treat Maharaja Ranjit Singh. But then as a practitioner, he started the whole thing from here. Calcutta. And slowly it spread and became so popular that though it started its journey in Germany, but homeopathy for all practical purpose has become an Indian system of medicine. And here in Calcutta, probably the first college, and that is still existing, and that makes it the oldest college in the world, the Calcutta Homeopathy College was established. That was established more than 150 years ago. And that was the first college institution where a proper systematic teaching of homeopathy was done. From there it spread. So people, whoever heard of it, they came from all over the world to learn homeopathy in that institute. So whether it was part of India or whether it was part of world, people were coming, passing out, and then carrying with them this learning and establishing it in their own area from where they have come. So what they were doing, what they have learned in this Calcutta school. And that is why somehow there was a new method which was known as Calcutta method. But in reality, there is nothing called Calcutta method. It was only a pure Hahnemannian method which was being taught at Calcutta Homeopathic Medical College and Hospital. And I know more about it because I was also an alumni, an ex-student of that college. So I have first-hand experience what was taught there. And my father was also a student of that college, and he was also later on a principal of that college. So I have also known from him and other teachers who were my teachers and ex-student of that college that what was actually being done there. So what was done was that in Bengal, especially in Calcutta, mainly the Keynote method was followed. Allen's Keynote became the basis for teaching. And that is why this Keynote method somehow became synonymous with Calcutta method. The fact is that Keynote is just one of the methods. And those who have studied Keynote, or especially the postgraduate trainee who have done their BHMS in some other institute, they have learned some other method, and then they have come to NIH or Calcutta, and then they are learning this method. So they will be agreeing with me when I say that out of all the methods that is being practiced today or taught, Keynote method is comparatively an easier method to practice, more logical method to practice, and a very good method to start one's practice. So, as you can see, that Calcutta method is a misnomer. There cannot be any other method of prescription in homeopathy other than homeopathic prescription or Hahnemannian prescription. What is the aim? The aim is to form an image of each drug that reflects a picture rather than maze of unconnected symptoms. When you are taking the symptoms of a patient, you are taking a history, you are getting a lot of information. And if you remember your organon classes, then according to organon, we have three sources: the patient, the relative, the attendant. And from these, and the physician himself, from these we collect all the possible information. And all these possible informations are gathered and they are then analyzed. But we have to keep it in mind, if this information that we gather, they are scattered in unconnected way, then that will not give us any purpose. So what is required is that this information that we are collecting, that has to be systematically arranged in a way that they are forming a portrait, they are forming a picture, they are giving us some hint about some medicine or a group of medicine in our mind. And the way through which they are giving the hint is Keynote. We all know that there are different methods of prescription. I am just naming them, I am not going in detail. There are different methods, like there are people who say they are basing their prescription on symptomatic similarity. Then there are constitutional similarity. There are people who say, I do constitutional prescription, I do miasmatic prescription, I do only classical prescription. There are people who only stresses on causation. So there are different approaches. Etiological similarity, then clinical similarity, pathological similarity, organopathological similarity. These are different approaches. But all these approaches are incomplete, partial. They are looking at one side of the coin. They are like those 6 blind persons who were trying to define the elephant. And wherever they were touching, they were seeing that, describing that elephant is like the tail or the trunk or the legs, like that. The fact is that elephant is a combination of all these. So whatever, this is an incomplete list, but whatever we have here, it is not limited to this, but it is a combination of all this that we get ultimately the similarity. Similarly, the method, the way we study Mathematica, the way Mathematica are written, they can be categorized. Again, this is an incomplete list. Schematic method, where a particular schema, anatomical schema, Hahnemannian schema, whatever name we give, but a particular schema is followed. Physiological method, physiological Mathematica, right or wrong, Hahnemannian or not, homeopathic or not, we are not going into that. We are just telling you the names. Then we have comparative Mathematica, descriptive or picture method, monograph, where one single medicine is described. Psychoanalytical, this has something new which has come up. Then there is Keynote methodology. These are not a complete list again, I say, but more or less these are the different varieties of ways in which Mathematica is written. Our aim is ultimately to complete the knowledge. I have to get the complete information about the medicine that I want to study, which ultimately will help me in prescribing. We have to keep in mind that in order to learn any language, suppose I want to learn German, it won't help me if I memorize the whole of German dictionary or any language that I want to learn. If I memorize the dictionary, it is not going to help me in any way. So similarly, if I am trying to memorize one medicine from a very big book or from the original source book, that won't help me. I have to learn those tricks, those methods by which doing something impractical and illogical like memorizing the dictionary. Without doing that, I can ultimately have a mastery over the medicines, which is what is going to help me in prescription. See, whether it is the medicine or the disease, what is visible to us, what we see, actually is only the tip of the iceberg. Suppose I ask any one of you, tell me 5 symptoms of any common medicine, say sulfur. Or I don't number them, I tell you, give me some symptoms of sulfur. So you will tell me 5, 10, 50, maybe 100. But is it all? There are, while accumulating clinical information and knowledge, we got so many more information, so many more symptoms. So what you are telling me is only the tip of the iceberg. Similarly, when I take up a case, when I see a patient, what I actually see is only the tip of the iceberg. So major part, if we stick to our discussion on Mathematica, then major part of the symptomatology is not visible to us. We don't collect those. Those remain hidden. But then how they are used? Are they of no value? They are of immense value. But how they are used? the same way that if you can identify any medicine, and for that identification, whatever number of medicine you need, whatever number of symptoms you need, suppose in order to identify sulfur in a patient, I need 5 or 10 symptoms, then those 5 or 10 symptoms are tip of the iceberg. But they are the part of the same iceberg, the remaining other than those 10, and they will also be a part of the sulfur. For those who have experience, who have accumulated experience, mastery over the years, they can identify only by looking at this. But those who have less experience, they have to go through the whole process, and in order to identify, you have to identify this. So basically, Keynote method is nothing else but a method by which you can identify a medicine by only looking at this part, the part which is visible, the part which is above the surface. Keynote method of prescribing is one of such methods which is properly understood, make the whole process of prescription much easier. That is what the Keynote method is all about. Let us go a little bit into history. Dr. Guernsey, William Guernsey, is credited with first using the term Keynote System. He published an article that was actually a transcription of his lecture. And that in that article, the name of the article itself was the Keynote Method System. And there, for the first time, he suggested this method. Dr. Guernsey was a teacher and a very popular teacher. So he was very much aware about the problems that the students were facing at that time when they were asked to learn about particular medicine. So he suggested this method. This is Dr. H.N. Guernsey. But before Guernsey, though Guernsey is credited, sorry, it is not William, it is H.N. Henry Newell Guernsey. Before that, there is Dr. Jacob Jeans, whose reference we get in the writings of Herring, who has been first. Herring has said that he was first person to use these methods known as Keynote method. The term Keynote was not used by Jacob Jeans. That was first used by Guernsey. But later on, Dr. Lippy, Dr. Allen, S.C. Allen, Dr. Stuart Close, Dr. Yingling, and so many others, they all followed and practiced this Keynote method. Even why it is called Bengal method or Calcutta method? Because the stalwarts of Calcutta, those who have popularized and established homeopathy in Bengal and in India, like Dr. Mahendralal Sarkar, Dr. B.K. Bose, Dr. Pratap Chandra Majumdar, Dr. N.M. Chaudhary, Dr. Gyan Majumdar, and many others. They all were following this Keynote method. This Keynote method of studying, teaching, and practicing, they were following. That is one of the reasons. And in later day, Dr. Mahendra Singh, Dr. Dubey, they all were practicing this method, Keynote method. Dr. Dubey, I must mention, I was fortunate enough to be his student, very close student in fact. He was at that time known as a living Mathematica because he has this whole Mathematica of Allen's Keynote, he has memorized it. Now, if you think that I will do it, then believe me, it is not so difficult to memorize the whole of Allen's keynote. You can memorize even Herring's guiding symptom. But the question is not memorizing, not mugging up. The question is correlating it. The question is practically using it. So when the patient comes and he comes and tells me, doctor, I have pain in legs which is better by motion, then saying, yes, these are the 5 medicines which have this symptom, which is written here, here, and here, and then comparing them, that where it is similar with this and where it is dissimilar with this, that is what was the speciality of Dr. Dubey. And that is what made him exceptional as a teacher, as a practitioner. So it is not simply mugging up or memorizing, but it is practically using it. So here, if you go to the preface of first edition, then S.C. Allen starts this preface with these words: the life work of the student of homeopathic Mathematica is one of constant comparison and differentiation. He must compare the pathogenesis of a remedy with the record anamnesis of the patient. He must differentiate the apparently similar symptom of 2 or more medicinal agents in order to select the similar. So what is required is you have to constantly differentiate at different levels in different aspects. You know differential diagnosis? So when a patient comes and tells you, doctor, I have pain in right lower abdomen, so your mind starts working. What are the organs situated there? What are the pathology that can occur? And what are the symptoms that he is giving me that can be correlated with the pathology? And that is how you touch, you don't touch, you ask the patient to go, you have an X-ray done, you have the USG, you have the blood examination. Ultimately, your aim is to differentiate. Differential diagnosis. And then also there is a comparison of the symptom, individualizing symptoms of the patient with the different medicinal symptoms that we know. We can take help of repertory, we can take help of computer, we can do it with our own mind. But ultimately we are trying to compare. And when we are trying to compare, we are trying at every question that we ask, at every step, some medicine is included in the list, some medicine is excluded from the list. So why it is done and how it is done is basically this: constant comparison. And then at the end of the whole task, you come and get yourself confused because 2-3 medicines are coming very close. Again, you have to compare between these 2-3 apparently similar, apparently closely running medicines. So comparison, when Allen says that comparison is a task which a student of Mathematica or homeopathy has to do throughout his life. It is a fact. Because for every prescription that you make, there has to be constant comparison. At every step, there has to be comparison. There has to be comparison between the medicine, the symptoms of the medicine, the symptoms of the medicine and symptoms of the patient, and different diseases. Professor Guernsey, being aware of the problems that his students have to face in understanding and applying Mathematica, he advocated that the characteristics are to be understood and memorized. When applying this medicine to the sick person, it is these characteristics which are to be sought in the patient. And if these symptoms are found in patient, rest of the symptoms will fall in line. He called these symptoms as keynote. Those of us who are from village or have some experience of the village, first hand or from hearing from about it, we know that snakes, when they go back to their hole, then only a small part of the tail is outside. Rest of the body is inside. But for a villager, He can identify the type of snake that is only by looking at that part. He can say, yes, this is a poisonous or non-poisonous, or if poisonous, what is the type? If non-poisonous, so what is the type? But for a city person like us, we need to get the snake, maybe take the poison, have it analyzed, and then we will say probably. But for a person who has been dealing with it, she can directly, confidently say this is this, just by looking at a small part of the data. Why so? Because of repeated exposure. Because he has repeatedly seen it. So similarly, when you repeatedly see the patient, when you repeatedly see your medicinal symptoms being manifested in the patient in different form, different age, different constitution, then you are able to identify it just by looking at the small tail. And for that, Guernsey has said it is better if we memorize, to start with as the first step. If we memorize some of the symptoms, why practitioners from Bengal, they outshine, don't take it as, by proud statement, but they usually outshine others as far as homeopathic prescription is concerned, homeopathic practice is concerned. I'm not talking about gimmicks. Why? Because they follow this method. In the first year, this is how it is taught, not only in NIH, but in most of the colleges of Bengal. And probably slowly it is picking up all over India. That in the beginning, you have to memorize 4 symptoms or 5 symptoms of a medicine. That is how questions are asked. That is how your exams are held. You are asked in exam, give me 5 characteristics of aconite. Tell me the female symptoms of sepia. You memorize it. And then in due course of time, you realize when you go to 4th year, final year, internship or post-internship, when you start your practice, then you realize that 5 symptoms that I have memorized as the characteristic of aconite, they were very good for passing exam. But in reality, there are many other symptoms which I have not said, which exist, which I have to know. So then you have a 5 points by which you draw a line and outline. And then you start filling up. And this filling up is done by yourself with your own interest, with your own knowledge. Nobody is forcing you. You filling up this information from different books, different journals. And then slowly and slowly your knowledge of Mathematica, of that particular medicine, become more mature and more perfect. And these start taking a shape in your mind. So you have now a shape of aconite, who may have more than one face, who may have more than one variety of cough, who may have many modalities, but all these are in your mind. And that is why when you sit in your clinic, you have a repertoire, but you don't use it. I don't say that it should not be used. I very much say that it should be used, because repertoire, most importantly, help you in not going in a particular routine way of prescription. But as far as snapshot prescription is concerned, quick prescription is concerned, many a times you don't need the help of repertoire except to confirm, yes, whatever I have given is right or wrong. That is what is required for repertoire. You sometimes don't need computer or computerized repertoire, because this is the way you have studied. And this has been initiated by Guernsey. As I said, Guernsey used the term Keynote System in 1868. The first article that he published, the name of the article itself was Keynote System. So if you are interested, that article is very easily available on the net. Please read it so that you can understand what Guernsey has to say about the keynote, and what we today understand from the keynote are the real one, or somewhere it has been deviated from original saying of the Guernsey. Dr. Guernsey defined keynote as fundamental note or tone on which the whole piece is accumulated. The keynote word we all know, that is commonly used for musical system. Of music, those of you who know about music, you know that the whole music is based on certain keynotes, certain keys on which its whole is based. So similarly, he has taken that term, and in analogy, he has used this term for homeopathy, saying that for every medicine, there are certain keynotes which will ultimately be your basis of that medicine, and you can form the whole medicine. Rest of the symptoms can be filled up. The word keynote is mainly used in the music, but one of the meanings which serve upon purpose is that the fundamental, word has many meanings. Any word you see in the big dictionary, you will find there are many meanings. Similarly, this keynote has many meanings. The meaning which suits us most is the fundamental or central idea, because these are the symptoms. Though these are fundamental to that medicine, can be symptoms that fit only one remedy. It can be so uncommon, so peculiar that it can fit only one remedy, or a few select remedies. Yet, many of our best keynotes fit many remedies. There can be keynote, but there are many medicines. That is why sometimes you find in your book, there are keynotes, and in bracket 4 or 5 medicines are written. So keynotes are not peculiar symptoms, uncommon symptoms. That has to be understood. They can be common to one, or they can be common to a group of medicine of some, yet many of our best keynotes fit many remedies. Yet it seems a keynote can in fact be strange, rare, peculiar, or it can be common. Keynote symptoms are symptoms which are so apparent, so clear, that they suggest a small group of remedies or even a single medicine. They has to be so prominent. We are not talking about theory. We are talking about a patient who comes and gives us the symptom. We have taken the history, and that person has given us history. And from that history, we find one or two or more than two keynotes which are so apparent, so clear that they suggest a small group or even a single remedy. Keynotes are actually peculiar symptoms which have taken on a highly characteristic flavor and tend to point almost directly to a remedy. They can be also keynotes. Yet, see the yellow word. If the keynotes are taken as final and general do not confirm them, you are sure to fail. Because the first thing when you are using this keynote system, the first thing that you should remember, and that should be dazzling in your mind at every step, is that keynotes are suggestive. Keynotes are not final. However sure that may be, even sometimes if the patient comes and he talks in the language of Allen's keynote, as if he has read the Allen's keynote, he comes and tells you, doctor, I have thirst for large quantities of cold water at long intervals. Even then, that is a suggestion. That has to be kept in mind. So the generals, if they do not confirm, then that cannot be the medicine. In comparing the symptom of medicine, we find that each medicine presents peculiar difference from all other medicines. These differences, every medicine there is a difference. There is an aspect on which they are similar, there are aspects in which they are different. So these differences by which one remedy is distinguished from another, those again are the keynotes of the remedy according to Dr. Guns. Bryannia and Rustox, are they similar or dissimilar? Apparently, everything is opposite. But Hahnemann himself says that it is not uncommon that you get confused between Bryannia and Rustox. There are points of similarity also. Rustox and Apis mellifica, antidotal, inimical. But there are so many points on which they are similar. So the points on which they are similar or opposite, the points on which they are dissimilar, these are their characteristics. These are what they make them similar. These are what they make them different. And these are what they will be ultimately help you in selecting the medicine or ruling out the medicine. So these are the if I ask you, define dog in 2 sentences, you will not tell me it has 4 legs. Because then it will come in your mind, there are so many other animals which have 4 legs. You will tell me those 2 characteristics which will make dog from apparently similar 4-legged, same type of animal. So basically those are the characteristics. If we understand this, then we understand Keynote method. Then we also understand what is Calcutta method. Then we also know how to use it. Because you never get confused between a cow and a dog. So you will never get confused between 2 medicines if you understand and approach this way of study. Guernsey has used these 2 words, keynote and characteristic, and he has used them synonymously. Later on, Dr. Stuart Close also agreed that Guernsey's keynote and Hahnemann's characteristic should be considered as synonyms. But many books were written, many articles were written, and most of them have not used these words synonymously, except S.C. Allen, for the first time, he used both the words in the title of his book. It seems like prescribing for single symptom. When we say those who do not understand Keynote method, they do not realize, they may think that Keynote method is like prescribing on a single letter. But it is not. It is only meant to state some strange characteristic symptom. It is these strong keynote, these characteristic symptoms that denote the presence of active miasm and sometimes of the suppressed one. Dr. Berries has approached it to understand the keynote through miasm. But you see, whatever approach we take, the ultimate aim is to individualize, to differentiate, to find out a medicine which may be similar to so many, but which will be totally different to any other. So, we do not believe in prescribing for a single symptom. We believe in totality of the existing active miasm and not in making see the case at a glance prescription. Sometimes, just look at the patient and you think of a medicine. That is, see the at a glance. That is not keynote. Neither it is prescribing on one single symptom. It does not mean that the keynote of the case alone to be matched with keynote of the medicine alone, and that other part of the case or remedy, the generalities, the particulars, those which are not keynote for that particular medicine, those are to be neglected, overlooked. That is not keynote. Keynote is simply the predominating symptom or feature which directs attention to totality. It draws your attention. It is a clue. It is a hint. It draws your attention to brainia. When the patient says, I have thirst for large quantities of cold water, it makes you think of brainia. But if it makes you prescribe brainia, then somewhere you have not understood homeopathy. You think of brainia and then you differentiate. See if other symptoms of brainia are present in the patient or not. If not, then you have to think of some other medicine. A prescription made upon a single keynote is false, no matter how peculiar it may seem. So no matter which textbook of Mathematica we refer to, our aim should be to isolate the keynote system symptoms of a drug which together form a coherent whole. You know, in the history of homeopathy, in the practice of homeopathy, keynote method has been severely criticized by many. That it is a faulty method, it is a wrong method, it is a non-homeopathic method, it is a non-Hahnemannian method, severely criticized by many. But those who have criticized, knowingly or unknowingly, they all have prescribed on keynote method. And I'm telling you with full responsibility, the one of the person who have criticized keynote method very strongly is Dr. Kent. And you go through the cases of Kent, any cases, you will find his prescriptions are made on keynote, but without telling that these are keynotes. Because what is keynote? Characteristics. What is keynote? Differentiating. What is keynote? Similarity. So how can you prescribe on anything other than keynote? Directly, indirectly, you have to use this knowledge. Again, are simply suggestive. S.C. Allen was a big advocate of the system. In his book, see, Keynote and a Characteristic, he for the first time joined the two terms keynote and characteristic. Both Guernsey and Allen made one thing clear, that keynotes are simply suggestive. You see the cases. Go to different old journals or books of Guernsey or S.C. Allen. You will find cases prescribed by him. And then you will understand how they have used keynote method. S.C. Allen, you know, if you go through the history, you should be knowing this. He was a polypharmacist. He was not a person who was prescribing on single medicine, single medicine. And then, in due course of time, he learned about Adolphe Lippi, that there was a person who was prescribing on very rare cases. He is treating cholera, he is treating this, he is treating that. So he went to see how it is possible. And he saw the cases of diphtheria being prescribed and cured by him, Adolphe Lippi, by one single dose. And from there he converted to single medicine, minimum dose. And he became such a big advocate of single medicine that wherever he found slightest deviation, whoever was it, Allen was the first person to get up and object. So much so, at one point of time, Kent introduced some of the medicine and called them synthetic medicine. Combination. Sulf. Symptoms, and his argument was symptoms of sulfur, symptoms of arsenic acid. And in one meeting, he was severely objected and criticized by SCI. That you cannot do this. People follow you. you are senior, you cannot afford to make mistake, because that mistake will be carried for generation together. And didn't realize it. Such was the large-heartedness of that generation that he realized it, accepted it, and next he never used these medicine, never published these medicine, disowned them. So anyway, that was Dr. S.C. Allen. Use of Keynote is to unlock the intricacies of vast Mathematica to point or guide the prescriber to remedy covering the case, the totality. The Keynote suggests in selecting the remedy from many apparently indicated medicine and commands a comparison with the totality. Suggests the remedy, but the totality confirms. Selection of the Keynote from a mass of symptoms is not always an easy task. The relative value of symptoms must be duly considered. When I am saying Keynote, I don't mean anything that we have studied in Organon. That has to be totally forgotten. The value of the symptom, evaluation of symptom, the relative value of the symptom that we give, that has to be kept in mind when we are talking of Keynote. We have to keep in mind the general, the particular, the common symptoms, their relative importance. We have to keep in mind the points which in aphorism 5 he has said, accessory circumstances, that symptoms, especially in case of chronic, these has to be seen in light of these accessory circumstances. Everything has to be kept in mind. The relation of concomitant and modalities with the case are the deciding factors. Those of us who say that keynotes are basically prescribing on one peculiar singular symptom, that is what the keynote is. And they very often give the reference of aphorism 153. That Hahnemann himself has said that singular symptom, peculiar symptom, uncommon symptom, they are to be taken into consideration and they should be the basis for prescription. They may not have read this 153 properly. I have highlighted these, that you see signs and symptoms. Here also, Hahnemann was not talking about one single. Hahnemann was talking about plural, uncommon symptoms, signs, because in no one circumstance, prescribing on one single symptom can be homeopathy. Dr. Herring has said, now it is a question how many symptoms we need to prescribe. There is no hard and fast rule. It is a question of identifying the medicine. If you can identify just by looking at the tail, fine. If you need the whole of it, that also is fine. But there was one reference by Herring when he says that in order that the tool should stand on its own, you need 3 legs. Some people have given this reference to say at least 3 keynotes are required. I have shared it here only to say that this is not right. This reference was, this saying of Herring was for some other context. We should not limit to 3 or 2 or 1 or 5. The purpose has to be kept in mind. And whatever symptoms are required for that purpose, that will serve the purpose. Again, it is not possible to exactly know that in the whole history of the patient, from head to foot, where exactly can I find the keynote? But these are some of the areas where one can easily find the change of personality and temperament before sickness and after sickness. Nature and peculiarities of the disease, seat of the disease, concomitant, cause, modalities, especially time. This is again not a exhaustive list, not a comprehensive list. This is just a suggestive list that keynotes are usually found here. The best way for studying Mathematica is to learn the skeletal of a remedy, that is keynote of the remedy. And remember, that's why books like Allen's Keynote, Nash, Leader, Boger are all famous books in hand of most of the leading prescribers we have seen. None of these books, these condensed books, whether it is Allen or whether it is Nash, what was the biggest problem of these authors, when they were writing or compiling these books? Their biggest problem was not to include the symptoms. The problem was to exclude symptoms because space is limited. I have to write aconite in one page. So it is not a question of what are the symptoms I will keep. It is a question of what are the symptoms I will remove. So this skeletal of symptoms, few symptoms that is included in these books or any other book, they give you a skeletal of the medicine, an outline of the medicine. And then once you have the outline, you have an idea about the medicine, later on you start learning, putting in more. That is why books like Allen, Nash, Boger are still famous books in the hands of most of the leading prescribers. Teachers like Dr. Dubey have taught us in that way, and we have in mind characteristics which we have never forgotten because they were given to us in that way. When Dr. Dubey used to take classes, we were fortunate enough to have his class. And at that time, it was mesmerizing. There was not a single student in class when he used to teach sulfur and who will not think that, yes, I am sulfur. And he will give sulfur to himself and to most of his relatives and friends. But later on, when we went into finer senior years or became teachers, then we realized that actually how many symptoms has he taught in the class? 5, maximum 10. But sulfur is not limited to 10 symptoms. But if you ask me, I still remember those 10 symptoms. Because that is the skeleton, that is the base, foundation which he has formed. Those foundation of 10 characteristic keynote symptoms that he has given us. And then I have put on building, veranda, room with other sources. That is what the keynote is. That is what the Calcutta method is. That is what makes this Calcutta method so unique as well as so practically successful. That we form this base, the foundation, and then we go on adding from other sources. And because in the initial years we have memorized it, so it became a part of us. These symptoms became a part of us. Keynote method is the distillation of constant thought of various practitioners. The revelation of their true observation and significant experience in the practice of medicine into a highly constructive, methodical, and practical form for healing of the sick in the simplest, most gentle, and reliable manner. And I like to repeat again what I said in the beginning, that there is no method called Calcutta method of prescription. There cannot be any method called Calcutta method of prescription. There is only one method, that is homeopathic method. That is Hahnemannian method. Anything other than this is not homeopathic, not Hahnemannian. Thank you very much.
So we'll sit here for question answer.
They will ask questions, the question will come there.
Yeah.
Yeah, they will also type.
So that will be the answer. You sit here, I take this chair.
I sit here. तुम लोगों को क्वेश्चन हो तो तुम लोग भी टाइप करो. बिना सर पानी पियो.
Thank you so much, sir. It was an amazing session, and it's really an honor to share this stage with you. So, if you have any questions, you can type in the comment section.
You want this?
Okay, and there is no hard fast rule that you have to ask in English only. You can ask in Hindi as well.
Thank you very much. Though a bit exhaustive, but it was a very nice session. Nice from my end. I enjoyed it a lot, and I'm sure those who are at the other end, they would also be gaining something. I expect that. That is the basic purpose of coming here and sharing.
It was really nice session and so many new inputs. We people coming from other states, not belonging to Kolkata, West Bengal, has learned. And basically, the misnomer, as you said, that the Calcutta, method of prescribing, Calcutta School of Homeopathy has been since so many years into our mind. And today, uh, all the confusion and misunderstandings about this method has got clear. Also, as you mentioned about that keynote is not about only a single symptom, prescribing on a single symptom, which usually is thought about by most of us, including me. But then that has been, cleared by you very nicely, very scientifically, I would say. So thank you so much. And let's, so
Questions are
people,
there?
yeah,
Yeah,
questions
please.
are asking. So, asking. Okay, I'm reading. So it's okay. If possible for me, I will read the name of the person, and so many people are don't mention their name. So
Okay,
only
wherever you
questions
get,
will
please
be
mention the
mentioned.
name.
Yeah. So it's asked by someone that what is mean by sitting on a remedy, which often heard in Kolkata practitioner. So I'm here listening to this.
I am
Person.
born and brought up in Calcutta. I have never heard this phrase, sitting on a remedy. As far as I know sitting on a chair. But sometimes people may use it, whom I do not know, I may not have heard. As far as I know, sitting on a remedy is when you are not deviating from the remedy, you are sticking with the remedy. Now, that is what we are supposed to do when I prescribe. I am supposed to stick with the remedy. But one thing has to be kept in mind that this sticking with the remedy has to be done when till the time there are indication in favor of that. Because my selection of that medicine is based on the indications, the symptom. So it should never happen that this sticking with the remedy should be done at the cost of the patient. Even if there are deviation or new symptoms coming up, but I am just sticking with the remedy, that will be something totally wrong. So one should stick with the remedy till it is logical, till it is not costing the patient his health.
Okay, so there's another question where okay, we are asking for if possible case discussion by Keynote. Is it possible? Go really.
It is possible because then I have not brought the cases.
Any case which
There
you
are,
remember, like
I
from
remember
your
a case
guru
by Kent,
or
which
from
was
SK Dubey or someone, like
they,
from you have learned.
I'll start with the case by Kent, who was a criticizer of Keynote
Okay.
method, and this was case was from his minor writing probably, where he has discussed that there was a lady and she has a particular symptoms, and that symptom was aggravated in the thunderstorm, and then one or two symptoms were given, and then phosphorus 50 mg was prescribed. So if we go through all the symptoms, we find that phosphorus basically was prescribed because there was this symptom, which suggested the phosphorus. Maybe other symptoms were in favor. So this is what the Keynote method is. If anybody want to learn Keynote, come to NIHOPD. Most of the prescriptions, knowingly, unknowingly, are done by Keynote method, and that is the key and to the success that NIH OPD had.
Yes, I think so. But then, what are the tips you will give for remembering these keynotes? Like how to remember it for, and how to practically apply it in patient.
First is that forgetting is natural. It is nothing abnormal if you forget. Second is we forget only those things we don't want to forget. So if you are really interested in learning, you will not forget it. And you need to have a group with whom you discuss. Then these things keep in your mind. And you use it, you remember it. You don't need any extra method of studying. Just the simplest method is start from Allen's Keynote or any other book, then go through different other books. You have the Allen's Keynote as the basis. Then suppose what I suggest is you start with Allen's Keynote, and in one sitting, suppose you are reading Aconite, then you read Aconite from Allen's Keynote, then go to Boric, then go to Nash, then go to Tyler, go to Kent, and then you can go on till you have the patience and energy and interest left. The moment you feel no, this is enough for me, you come back again to Allen. You should start with Allen's Keynote and conclude with Allen's Keynote in one sitting. Average 3 or 4 hours is enough for one medicine. But then next day, most of the things that you have studied, you will forget. So what you have to do is you have to read a small part of that next day or discuss it with somebody next day. That is how you remember it, and by using it.
So basically, it's like going from smaller books like
Always,
Keynote and
always.
then to bigger ones.
As I said, these smaller books have less symptoms. And less symptoms are the real symptoms, and they form the foundation. And on that foundation or skeleton, outline, you go on adding more symptoms from other sources. The other sources initially can be your Nash, can be your Tyler, can be NM Chaudhary, can be Boring. And then you go on adding. The more interest you have, you go on reading bigger books. Start with the small so that you keep the interest. Once you yourself are interested, you can go ahead with any book that you want to read. Just don't read any book which has interpretation of the symptoms. Where they are, I should not name the book, but I am telling you quite clearly to understand. Symptoms are to be taken as it is. Explanation of the symptoms are not required. Explanation, because if I rely on explanation, my explanation and your explanation can be different. It may happen that I am more learned, more experienced than you, but you have published a book, I have not published a book. So people are reading your book who have no experience. And those who have experience, he or she has not published the book. So why go on interpretation? Hahnemann was very, very categorically against interpretation. He said symptoms has to be taken as it is. Symptoms are the sole guide. Symptoms has to be taken in the language of the patient that they exist. So no interpretation, no psychoanalysis, no stories.
Absolutely correct. But then, what is the method of reading Allen's Keynote? Because it is a Kolkata basically the place where keynotes. As you said, you can memorize whole book if you are interested. But then I think there is some method, and which is followed wrongly.
Dr. Hina, we need another session to discuss how to read Allen's Keynote.
Sure, sorry.
But I can just tell you for the beginning, there is no hard and fast method. You are very much welcome to start from A, go to Z, find out your own method. Nothing, it's not so difficult. Symptoms are written in black and white. Anybody can understand. Those which are written in bold are more important. Those which are written in italics are comparatively less important. There is a particular arrangement, there are particular sources that need elaborate discussion. For now, I will tell only this much. My advice to the listeners or those who are interested is only this much. Get yourself interested first. You will find out your own way. जहाँ चाह है, वहाँ राह है.
Absolutely. So another question is, so the question someone is asking is related to organ of medicine, and I don't know we should take this or not,
Sure.
but then it's just a basic question that what is the basic difference between fifth and sixth edition of Organ of Medicine?
Can you name the person?
Name is actually the real name is not mentioned.
The first name.
It's something red snow goon, red snow goon, something.
A red snow goon. This read any of the common books that is available in the market. You will get the difference between fifth and sixth edition. There are so many differences. But thank you for getting interested in organelles. People who are getting interested in organelle are very less. So whether it is red snow goon or blue snow goon, thank you for asking.
Okay, so another question is from Mr. Jayant Krishna, and he says that keynotes never cover the totality. So, how it can cure a patient?
Of course, it never covers the totality. The purpose is it should not, it cannot, it will never cover the totality. That is why it is suggested. When a patient comes and you take up the history, and in the whole history of the patient, you find that there is severe component of burning. The burning is very prominent. And so much prominent that you think that this is a characteristic. This is a keynote. The moment this thought comes in your mind, the burning group of medicine comes in your mind. And then you start further questioning. Burning which part? Single part, two part, all over body, morning, noon, night, better by cold, better by warmth, how, with itching, without itching, sensation of rawness, not sensation of rawness, better by itching but later on burning. And with each symptoms you get closer to your similima. That is what so burning was the keynote. And then for every step, you further differentiated, and step by step you came closer to your totality. Because as I have said repeatedly, these are suggestive. We are not supposed to prescribe under any circumstance on keynote method, keynote symptom. They will suggest, but other symptoms, which are part of the totality, they will tell you this is right or this is wrong. If keynote is saying right, but the totality is saying, this is not the medicine, have no doubt, no hesitation, just rule out that medicine. Because keynote are not the final. The totality is the final, which will decide whether this medicine is right or wrong.
Okay, so another question is that what are the journals you suggest that one should read in early part of homeopathic practice?
Now is a very bad and dark phase of homeopathy. There are so few journals. And those few journals that are there, God only knows what they are printing in name of research. Because most of the places, our young generation, they want their article anyhow to get published in the journal because that carries some marks in their interview for job. So very few journals are there which carries real hand experience of the practitioners, the failure or the success stories. That was the unique character of the earlier journals. So my suggestion is, I'm not saying that you don't go through the earlier latest journals, go through them, but more learning also can be had from the earlier older generation, whether it is Recorder or whether it is British Homeopathic Journal or the Calcutta Journal published by Mahenlal Sarkar. All these are in today's time. Most of these journals are available online. You will get it. Just you need to go for have this much of patience to go for it, search for it. You will get it. Yes?
So, can you now it's been clear what is if there is no such method as Calcutta method of prescribing, and to learn this keynote prescription, we should have we should be a voracious reader. We should be reading more of Materia Medica. But and if we select the correct simillimum, correct medicine, then the next question arises is about potency. which potency to be given and what is the exact potency to. Can you highlight about
Dr.
this?
Hina, this cannot be answered in one line. Potency is a big topic. And for potency, there were no specific guidelines by Hahnemann. He has given broader guidelines which need to be applied. He has given hints because basically the first task is to come to the medicine. And then you can decide whether it is acute or chronic, whether it is constitutional prescription, or whether you are giving it for some one or two symptoms. And that will help you in deciding what will be the potency you will be selecting and how you are going to repeat it. I will suggest that beside Hahnemann, there were other stalwarts who have written on this potency, selection of potency, repetition. I'll suggest to read those. There are specific and very clear guidelines which need to be followed.
So I think questions are there, but that is not relevant to the session, I guess. So we'll skip that. Extremely sorry for that. One question which I have in my mind and would like to ask is that I'm coming from a state like I'm from Maharashtra, where no government homeopathic medical colleges and jobs are available. So the last thing, all everyone like after completing their graduation or post graduation, we are supposed to do is practice. Okay. So, but then, as you said, if you want to learn this method, come to NIHOPD, but then practically it is not possible for everyone. So, what you will suggest for all those who cannot be here, who cannot come in Kolkata and NIH basically, but then they can practice this method or keynote prescribing, or they can be a good practitioner basically.
Again, I will repeat. जी जहाँ चाह है वहाँ राह है. You don't need to come to NIH to learn Keynote or to be a good. There are so many good practitioners who have nothing to do with NIH. I am not saying that all the good are only in NIH. Only thing interested is important is you have to get yourself interested. Have this confidence in yourself that I will do homeopathy, only homeopathy, pure homeopathy. And then you start working on it. Today is Makar Sankranti, a very auspicious day. Start from today. Reading, you start from Alan's keynote. And there are, in today's time, you don't need to come anywhere. You face problem, you share with your problem. I cannot say every problem I can address, but I can say only this much that there are means and method by which your problems can be solved. Only thing you should have the will कि हम करके छोड़ेंगे फिर देखिए रास्ता निकलते रहता है.
Absolutely, sir. So, thank you so much, sir.
Thank you.
Yeah.
It was nice being here. Thank you so much.
So, yeah.
अब तुम लोगों को कुछ पूछना हो तो पूछ लो. बता दो कि क्या है. You want to ask anything? पूछना है? या वो blue moon वाला तुम ही लोग से?
So thank you so much everyone for joining. That was all for today. Thank you.
बोलो कुछ पूछना है? About this whole keynote method. If there is any doubt, please ask.